Welcome back to Startup Health Now, the podcast where we celebrate the entrepreneurs and innovators shaping the future of health. I'm Logan Plaster. Before we get into this week's episode, just a word about Startup Health's Moonshot Impact Fund. For accredited investors, this fund makes it easy to gain exposure to a diversified portfolio of private health innovation companies. You can find all the details as well as sign up for an upcoming informational webinar at healthmoonshots.com. Now, on to today's show. This week, we're getting tactical with two founders from the Startup Health family to talk about sales strategies. Our first guest is Reed Mollins, the VP of Strategic Partnerships at Press Ganey. Mollins is well known in our community for co-founding Doctor.com and scaling it over most of a decade before being acquired by Press Ganey last year. Our second guest is Brian Neman, the CEO and founder of Sanguine Biosciences. Brian built his clinical trials platform from 0 to 8-figure revenue today. The conversation, which was held in front of a live audience of Startup Health founders, was moderated by Katya Hancock, Partner and Investor Network Director here at Startup Health. Stick around.
Today, we're really going to be talking about sales. And these two gentlemen, Reed Mollins from Doctor.com, Brian Neman from Sanguine, they are extremely good at sales, both individually, but also building effective sales organizations that have generated significant revenue. Without further ado, I'm going to ask these guys to introduce themselves. Reed, why don't you start us off? Tell us a little bit about yourself. What's your role at Doctor.com, which is, if you guys hadn't heard, it has now been acquired by Press Ganey at the end of last year, which is just awesome. We're phenomenally proud of that. But tell us about your role at Doctor.com, because I know you're a co-founder, extremely instrumental in the successful outcome there. And then also, I think it'd be interesting to hear personally, what do you attribute your kind of natural salesman proclivity to? Is there any family member who inspired you, or it seems to come so naturally to you? But tell us about yourself and Doctor.com.
That's a significant tee up. Thank you, Katya. I appreciate that. At Doctor, I was one of the founders and was chief strategy officer. But in many ways, what my everyday role was the development of new markets and the assessment as to whether we had product market fit. And the way I kind of did that and thought about it was effectively selling ahead of wherever we were based on whatever tools we had in our toolbox to completely new markets. And so what that meant was, in the very, very early days, I was assessing product market fit with individual doctors and managed to close a bunch of individual docs. And then we were like, I bet we can actually sell this to bigger groups. So started approaching mid-market, folks with like 30, 50 national footprint provider sets, and closed a few of those. And we're like, all right, well, how do we apply some of these same tools maybe into the payer space? So I ended up closing our first health plans. And they're like, all right, well, now we have a bunch of tools and we have engagement. How do we make that fit? Maybe pharma would be interested. And so we started pitching pharmaceutical companies and started bringing them in as clients. And in a lot of ways, what my role was all revolved around looking at the tools we had access to, trying to figure out if there was some market that could utilize them in a way that we hadn't necessarily imagined it yet, and then do just as many pitches as I could to as many people as possible, all while being very transparent around the fact that we had never applied this particular technology into their particular market, but the firm belief that it was very possible, and that the understanding of the tech as well as the understanding of their market put me in a position where I could convince people to take a flyer on us. And so sometimes it was like innovation folks, but more often it was just buyers in particular institutions who had a progressive mandate to try to figure out how they're going to evolve their institutions. I often talked about it like I was like an explorer hacking my way through the jungle. And so I pitched so many things to so many institutions for so many years, and you'd be like hacking your way through the jungle until you find a place where there's like arable land and two rivers meet, and you're like, oh, there's actually product market fit here. This is a place where we need to at least set up base camp. And I would bring in a little SWAT team of mostly product people and some client success folks to start handling the first customers we were able to get set up in that little base camp in that place with arable land. And that once we really established what the client was going to get and how we were going to do it, and it felt repeatable, then I would put my hat on and sharpen my hatchet and like head back into the woods and try to find another place where there was sort of arable land and an opportunity to try to sort of build something. I credit almost all of that. My dad was an entrepreneur who ended up landing in the car business and running these giant national sales teams. And so I spent like my whole childhood like playing at car dealerships with the nitty grittiest salespeople I've ever met in my life, then or now. And so it's become an important part, sort of the ongoing part of my career.
Sorry, there's a lot to dig into there. Because you make it sound like, oh, we just sort of jumped from lily pad to lily pad, from small to medium provider to payers to pharma, but each of those steps was a significant, thought out milestones that you achieved. And so I would love to dig into kind of how long it took you to go from one to the other. But let's have Brian do his introduction. I just kind of preface a later question. I think a lot of people on this call are still trying to figure out product market fit, and they're trying to figure out time management. So if you've got one customer that's actually already paying, but you don't think that's the big kahuna opportunity for your future strategy, how do you figure out where to allocate resources and that kind of thing? So that, I think, is something to dig into. Brian, why don't you introduce yourself? Thank you for being with us.
Well, thanks for having me on, Katya. My background, I started the company about 10 years ago from scratch with my partner, Gerald Lee, who's also a startup health transformer. And we've taken very limited amount of funding, I think a total of $5 million. And we've gone to a place where we're generating a good chunk of revenue with that, into the 8 digits of revenue annually. So I'm happy to be here, answer any questions. And what our company does, I'll give you some feedback on that, some information on that. We help serve pharmaceutical companies and patients by making it easier for patients to participate in research. We have a staff of about 150 mobile phlebotomists and nurses that go to patients' homes to draw blood and other specimens, and then provide that specimen and related data, including medical records and patient-reported outcome surveys, to researchers at the smallest of the small budding biotech companies, all the way to the largest pharma companies in the world. So COVID was an interesting ride where at the end of Q1, every client put their existing projects in, say, lupus and sickle cell on pause, and turned on, every client wanted to do COVID research. So a big pause and then a big rebound. And we're seeing that now come back to the earlier normal, which was research on all conditions, not just COVID Delta. So happy to share any of my experiences with the folks today.
And Brian, was there anything in your background where you pulled a lot of sales knowledge from, whether it was personal relationships or a mentor or anything like that?
Yeah, similar to Reed, though, his father, it sounds like his father had plenty of formal training and experience, so that's great. My parents, my uncle, father, were entrepreneurs in the wireless cell phone space back when you didn't go directly to Apple and not everyone had the iPhone, right? You had LG, you had these different types you could look at. So both in retail and in wholesale, so B2B and B2C, I had some exposure on that level, but nothing formal in that regard.
Awesome. So both of you, I'm going to assume, tell me if I'm wrong, were the first salesperson at your companies. I'm sure your co-founders were also, everyone was all hands on deck, but you were leading the charge. So Reed, walk us back to those early days. You talked about, like I said, jumping from kind of one to the next, but in the early days, how were you thinking about your approach and your strategy? And how long did it take you? I believe you had something like tens of thousands of private practice clients at the time of acquisition, hundreds of health systems, extremely impressive. And then that's not even to get into your partnerships with payers and pharma. But in those early days, what was your strategy? What were you setting out to do? What kind of milestones were you putting out there for yourself?
Yeah, it's a great question. In the very earliest days, doctor.com was just a domain that had a doctor directory on it. It was effectively like a broken apart version of NPES, made a little prettier and wrapped around with ads. So most of our revenue, maybe half our revenue, just came from AdSense. And then we were saying, okay, CPMs are pretty low in the market space that we're in. We would love to get direct advertising. And so we sat down to say, all right, how do we get direct advertising? And the plan effectively became me cold calling brands that I thought would be interested in the demo that was using the site. And so we got really good at understanding the demographics of the site. And what we discovered was that it was like mostly women, head of household, college educated, sort of master of care for the household. And so with that demographic profile, I just ran around and tried to find people who I knew would be interested. So my favorite was I started picking up Martha Stewart Living magazine in the grocery store. And I assumed that anyone who was paying to advertise in Martha Stewart Living magazine wanted to advertise on doctor.com. They just didn't know about us yet. And so I just brute force went through those lists, finding the people, those institutions that I thought would be the right folks, and called them and pitched like at least 10 different custom things, most of which didn't exist, but just trying to like capture their attention and interest. And eventually had enough dialogue with them that I understood that there was a product that we could deploy that'd be beneficial for them, which was like customized content. They didn't want to just buy banner ads around doctor pages. They wanted customized content that lived on a doctor.com subdomain that they could make one of the cores of their online marketing strategies. And that wasn't my idea. That was one of their ideas. And we just took it and ran with it. And so we started adding direct advertising revenue, which just crushed all the CPM numbers that we had. And from there, it became clear that there was sort of broader opportunities with the platform. It was getting enough traffic. And so, we did kind of what Brian describes, which is like you're revenue positive, and now you start investing in the next product set as you try to sort of grow the business. And the thing that we added was the ability for doctors to claim their own profiles, because we assumed some amount of the traffic that was coming to the site was doctors Googling themselves. We know that doctors do that. And so we didn't know how frequently it was happening. We didn't know if there was an engaged audience there. But as soon as we added the ability for them to update their own information, we started watching like tens and then dozens and then hundreds and then thousands of doctors actually claiming their profiles. And so we want to understand like, what were they doing? What did it look like? So we started installing tools on the provider facing side of the site to let us observe what their behavior was. And a company called Lucky Orange had just come out with a really nice tool that would let you watch in real time as people did the actions on the page. It was basically just like click tracking and mouse tracking and producing like a live video for you to see. And so we started observing like what doctors were doing on the site, where they were paying more attention, what aspects of the profile were most interesting. And so once we understood that they were mostly interested in putting up a photo, they were mostly interested in updating their phone numbers, it became clear to me that they were trying to sort of own their online presence to the extent that was possible. And so I started just calling every doctor that signed up. 15 minutes after a sign up, they would get a phone call. And I started pitching them all kinds of different things. I pitched them building them websites. I pitched them doing online scheduling. I pitched them like sort of managing presence around the web. I pitched them AdWords packages, just like anything I could think of, just to see where people got most excited. And I made sure in those really, really early days, talking to an individual doctor, that if the call ended with them excited, but not willing to take out their credit card and actually buy a thing, it was like, nah, they're interested. But if I could get someone to take out their credit card and read me the number, and I wouldn't even write it down and have anything to sell them at the time. I was just sort of practicing. I would let them read me their credit card number, and then I'd call them back 2 days later and be like, hey, really sorry, we decided to sunset that beta. That product's not going to be available, but if you're interested, I could put you on the mailing list, blah, blah, blah. And so in that way, just getting enough content and feedback around really how people were interested in what they were interested in and whether they were willing to go to that final step. Because you can have like a lot of great conversations, but if it doesn't end with them taking out their credit card, like that's still not really a sale. So that in the very early days, it was like me trying to learn everything I could learn, not because I wanted to be our only sales guy, but because I needed to understand where we were trying to push the business and where it was going to work.
And that's really interesting because, in the early stages of any business, you're trying to find product market fit. You're trying to find what people are interested in, but you also don't want to come across like you're just throwing spaghetti against the wall.
Exactly.
And so what do you attribute those early successful conversations to? Was it sort of like a fake it till you make it, come in with a confident product offering, even if it's not your strategy for sure?
Oh yeah. So here's actually one of the places where having a partner was really important. So Andre is like really an artist. He graduated with a degree from art school. He's an amazing designer. And so he was making these very professional looking decks for products that didn't exist. And then I was walking into these conversations very confidently selling a product that I knew didn't exist, just to see if I could get them enthusiastic enough to do it. And so we had a bunch of different decks for a bunch of different products. And in no one conversation did I throw too much out. In every individual conversation, it was like, okay, we're going to experiment with selling this person an AdWords consulting package. Okay, in this pitch, we're going to experiment with selling them a website product. In this pitch, we're going to experiment with, and just so on and so forth, and just did them at scale. And like, I didn't feel like I knew whether I had product market fit until I'd collected like a dozen credit cards on something, because you know, even a stopped clock is right twice a day. If you make enough phone calls, someone will buy something. That doesn't mean you have product market fit. It means you got one person to say yes. And so I was really trying to hit scale before we spent any time or money developing anything.
Yeah, that's really interesting. You were definitely combining your sales process with the early product development, which is a common attribute you hear in success stories, is just maniacally getting feedback, incorporating that, investing in your customers to keep improving, that kind of thing. Brian, same question to you. Tell us what it looked like in the early days. Was pharma always your customer? And have you stayed kind of on that one track? And how did your strategy start out and evolve?
Yeah, so I feel like my path was similar to Reed's, and I'm guessing that's probably not dissimilar from other entrepreneurs, which are, you know, on the DISC assessment, high D dominant personalities, that want to get a script and a phone book and just smile and dial. You know, it's a lot of energy there. So we definitely went down that path. We did not have that same product market fit as it's defined in the last example, because we always knew we were going to sell to early stage discovery researchers in the preclinical world. So there wasn't really a discussion around that. It was more about the product market fit, depending on how you want to stretch the definition. For us, was really what diseases or therapeutic areas did we want to focus on? Is it oncology? Is it rare disease? Is it autoimmune, infectious disease? So that was kind of our product market fit exercise. And we found that we were really better suited, given our model of engaging patients and going directly to the home. We thought that that fit better with rare diseases that where children are mainly afflicted, and in autoimmune conditions where mobility is, you know, not always, you know, where you have flares and pain crises in those episodes. So we really had, we really found that was our niche. And what we found is that, and this is where it gets into sales, is that if you know that you're good at something, and that one or two specific things that you're better than at anybody else, that's where you're going to have the most engagement. So what we've noticed is that in autoimmune conditions such as lupus and rheumatoid arthritis, and rare diseases such as sickle cell and Duchenne muscular dystrophy, our win rate on projects is north of 65%. So the likelihood of the researcher working with us is exceptionally high. But then you look at other conditions such as oncology, which is in our specialty, it's lower than 20%. So that's where we're tracking as it relates to, you know, product market fit and how we got started. So it was really a journey of, we know the customer is, now what variety or what modification of our product will work best for them. And so we've now identified and defined what specific conditions within which therapeutic areas are interesting. So when we do now we're getting into like product marketing exercise. What we did is we pulled a list of all of the public and private pharmaceutical companies in the United States, and then went through each of their publicly available pipelines and defined whether, what conditions they have. We tallied that, and then we assigned a numeric value onto, let's say there was a company that had lupus, rheumatoid arthritis, and Crohn's disease, which are our specialties, but they were smaller. That company would have a higher priority than a larger customer. That company would have a higher priority than a larger client with, let's say, oncology and a big R&D budget, but conditions which we weren't specialized in. So we actually went through and did that market sizing exercise. And then, the next part is kind of advanced. We assigned inside sales and outside sales folks to those specific territories, which we can discuss later, but want to just give you a spectrum. We knew what we were specialized in. Then we found other companies that could fit that sort of mold, where we knew we had kind of a cheat code, so to speak, of winning specific projects, and then we replicated success.
That's awesome. It sounds a little like a thing that we did in the early days, which was once we knew what product we were selling, we would like meticulously track the competitors that other folks would ask us about. Either they said they were using, or how are you guys different from this? And we would just track all that. And because this was also marketing centric, it became pretty standard for us to figure out ways to identify which of our customers were using which of our competitors. So way back in the day, there was a lot of like battle over the marketing dollar of the private practice doctor. I mean, ZocDoc was a big name in that space. We were in New York, they were in New York, so people kept asking, like, how are you guys different from ZocDoc? It's one of those competitors we identified. And so every month, every 6 weeks, we would just run a scraper harvester through ZocDoc and find every single person that was paying ZocDoc. And then we would feed that all into Salesforce, and we would assign that to SDRs to reach out. And in the midst of the conversation, be like, hey, I see you're using ZocDoc. How do you like it? And depending on what the person said, we had a pitch that was like in line with their reaction or response. Person goes, oh, I signed up for it 2 years ago. It was great. Now I'm just not getting as many patients. We'd be like, dude, I know everybody says that. The problem is that they're not everywhere around the web. You should use our product, blah, blah, blah. Or they're like, oh, it's actually great. I get a ton of patients. They're like, dude, that's amazing. If that works well for you, this is going to work well too. It's the same function and feature, get out in front of the patient in a consumer web. And so we would like pick a competitor. We would find a way to scrape up every single doctor that was using that competitor. And then we develop these little customized pitches, and we would send the sales team after them. That way the salespeople aren't doing any prospecting, and they can just pick up the phone and just run dial after dial on the same kind of talk track. Very important to try to find ways to, to Ryan's point, kind of hack some of those early decisions around who you're going to contact and what are you going to say. Because if you can't figure out a way to scale who you're going to contact and what are you going to say, then you're always stuck having like a very senior person who is likely sort of like founder level and could be focusing on other stuff. You're going to have them doing this like pretty rote grind, because sales, and especially the kind of outbound phone-based sales, is very much a rote grind. But it's the best way to get the most feedback the fastest.
Mm-hmm. And there's definitely, a conversation to be had around the different environment with an outbound phone-based sale, to small to mid-sized practices versus more of the enterprise sales. And at what point did you start spending more of your time? You kind of had this revenue base with the small to mid-sized practices, Reed, and then what point did you start saying, hey, I'm going to spend X percentage of my time evaluating or learning from, payers and pharma where there are these much larger deals to be had?
Because I'm a selfish person, I made that decision very early. I did not want to be doing that rote grind. So the minute we had legitimate professional salespeople being run in a bullpen by a professional sales manager, I started spending most of my time on development. So it started with like just bigger practices so I could leverage the work we'd done before. And then whenever I got an opportunity to pitch a payer or pitch pharma or pitch a hospital, I would take it. But as quickly as possible, I saw myself as development and really business development, and that ongoing repetitive sale is the That is the area of professionals. There are people that are specifically that.
And just a more tactical question, I think for both of you, at what point is it appropriate to bring in a sales manager to manage your sales team versus, you know, someone at the founder? Was there like a trigger where you said, okay, now this makes sense?
So for us, we made the call once I'd collected like a dozen and a half credit cards on the same product. I was like, this is saleable. Someone else can do this now. And so we found someone who was, and we did this a lot through the early days, was find someone who kind of has like hit a glass ceiling at their current employer. You know, especially on the sales side, there's this thing that happens where very talented salespeople get stuck because they're generating so much revenue for their employer that the employer doesn't want to promote them, like doesn't want to move them out of the role. Like it's, you get trapped as a salesperson. And so we very specifically went out there looking for someone who aspired towards sales management and sales training and loved to coach, but was currently a sales rep, and where we could position to them to say, hey, listen, you know, you're going to join us as a rep just like you are now, but unlike your current environment, like we explicitly want you to get good at this pitch and then find people and train them into it. We want you to run the team that we're building. And so that was our sort of early strategy. And so Jorge joined the team. I think there were only 4 of us at the time, or 5 of us at the time, really early.
It's tough because it depends on how much capital you have to deploy. And we didn't have any. So what we did is we ended up working with a group called Predictable Revenue, who would do the prospecting work for us. And because I knew that I wasn't going to be prospecting as CEO of the company, so we sent it out to Predictable Revenue to prospect. And then once they got us the meeting, because really this is enterprise, right? I mean, however you look at selling it to Pfizer is, is the whole thing. So the thought process was that if we could prospect and I could close, or we had like a sales kind of like a product specialist, like sales engineer on the call at the time, so at the company at the time. So the idea was that if we could prove that we could prospect this, that was the most important thing. And then if we could close it, because I knew we could close, the question is, would prospecting work? So that was the question that we need to answer for ourselves, because we have more of an enterprise level sale. No researchers are picking up the phone. So it's like there's email, like do email cadences work? So we had to prove that out, and we did. And then I think the first thing we did was, if we proved prospecting worked, I couldn't close anymore because I was, I didn't have the time. So I decided I'm going to train some closers. So we hired a couple of account executives, which are doing phenomenally now. And then I said, okay, well, this throughput of the prospecting isn't high enough. We're not sending out enough emails. We're not getting enough meetings. So after 4 years of Predictable Revenue, we decided to bring it in-house. So our first sales development reps we hired towards the end of 2019. And one of them happened to be a senior sales development rep. And she just did so well during COVID. And I know she wanted some advancement in her career. And so she became the sales development manager. She started off with 2 or 3 SDRs, which basically is like outbound prospecting. And we are now at, after a year and a half of her in that role, we're up to 12 outbound SDRs. So she's doing phenomenally well there. And we're still trying to develop the playbook for closing. So I've identified one of our account executives who would transition to the sales manager role probably in 9 months from now. So that's been our path. Really, it's the question, was prospecting going to work for us? And that's been the biggest thing.
So I would like to talk about the playbook for closing, because it's often not the hardest part to get a meeting, right? And people have great meetings all day long. And I've talked to so many entrepreneurs who say, everyone loves it when we have a meeting. but it's managing that sales process, getting them through the funnel, and then closing. So we'd just love to hear what were the things that you guys learned along the way, that the things that you did wrong, and then the things you figured out were kind of key to getting people over the line.
For us, I think what became the most important thing was the quiet follow-up conversation. That coming into it, it was very clear very fast that you get 15 people from enterprise on a call, and you have like 4 people from your team. It's like it looks like this screen. It's like you're on this webinar on a call. No one ever buys anything in that environment. It just isn't the right environment for someone to decide they're going to spend that money or commit those resources. Instead, what we started doing was using these calls to run giant discovery, and mostly to suss out who was our main champion and who was our main detractor, and then wrapping those calls, trying to get as tight as we can with the champion, and to the extent we thought it was possible, see if we can get in good with the detractor. Because in many cases, folks that were detractors on those calls, it wasn't about the software service, it wasn't even about the value props. It was like, it was always something different. But if you could get in front of them in a quieter room, you could get an opportunity to elicit from them what their actual objections were and what their issue was with go forward. And so we would just be like putting ourselves on the same side of the table as our champion. Hey, what do you need internally? Like, how does procurement work? What does this actually look like? What can we get you? Have you done this before? If not, should we talk to your boss? How can I? And just like feeding your champion everything, and then using the big calls to suss out who might be giving them a hard time and see if you can make them champions in these sort of like quieter dialogues. That became super important for us, is that sort of picking your marks process.
Mm-hmm. I can definitely relate to that. As most of you know, I'm really involved with the fundraising at Startup Health, and there's almost always a close relationship that develops between someone on our team, whether it's Steve or me or Unity, and the champion. Especially if we're talking about a strategic investor who you text before or after the meeting, or you get on a phone call, and whatever you can do to figure out what makes that person look good to their boss, or what do they really need. Those little nuggets can make all the difference in just developing those relationships. So I totally agree with that. Anything else, Brian, in terms of things you've discovered about the playbook for closing over the years?
Yeah. Depending on how you define closing, if you're talking about maximizing your win rate, I feel like the best way to maximize your win rate is to scrutinize the prospecting even better. So like lead qualification calls. So for us, it's been like discussing budget as soon as possible with a client has been the most important thing. What they're like price per visit or price per sample, and the lens at which they've been looking at things. So if they're looking at I think they're moving from a price-based or cost-based sale to a more of a value-based sale was pretty critical for us, because the way we separate ourselves from the competitors, because we charge more than they do, but if you in aggregate, but on a per data point basis, we actually charge less. So what I mean by that is that the competitors often provide just the blood sample, with saying when we're providing surveys, blood sample, and the medical record. So in aggregate, yes, more expensive per sample, but less expensive per data point per person. So that's the way we kind of framed the discussion with folks. How much more are you getting, and what are they really buying? Is it the sample, or are they buying an outcome? So trying to understand the pain point first, and then understanding what kind of outcome they would like, and then working backwards as to how your solution fits that outcome, and how you can tailor it to that outcome. So that's been the other piece. Then there's another component, which is the enterprise level, which is if you're selling to an early stage biotech company with a couple hundred employees, they don't have procurement departments the same way that a Pfizer would, or Takeda, or Vertex, or whatever. So that sale process is a whole different beast, because now you have a business user, and then you have the purchaser, which are two different entities. So what you're going to have to really, if you're talking about enterprise sales, you're talking about multi-persona and how to navigate their organization to guide towards the sale. So not all customers, so just because the person, the scientist, performs the same function at multiple different companies, it doesn't mean that the organization behaves the same. Does that make sense?
Mm-hmm. Yeah, it does. And I really disagree with so much of what you just said. The thing that you said early on about quickly qualifying leads and prospects, I think is so key, because people will waste a lot of time on conversations because they're hearing some positive feedback. But quickly understanding, first of all, does the person that you're talking to even have any power over budget? Do they have any decision-making ability? Asking early, what is the decision-making process there? Who needs to be involved? Who needs to sign off? The sooner you can understand that, the sooner you can make sure you're spending your time in the right way. So, Brian, one thing you mentioned churn, and I know that forecasting sales cycles and understanding churn and seasonality is something that you're really good at. Can you share a little bit about the importance of that and kind of how you approach those topics?
Yes. So I'll separate the two things out. So the churn, we're still trying to evaluate it now, but I think at least in the pharma space, I think Dr. Alexandra Greenhill was bringing up the pharmas and getting in there. So I think with regards to pharmaceutical companies, we know that most of our continuous growth within continuous growth within the company is going to come from high net revenue retention from those clients, meaning Pfizer has a higher likelihood of growing year over year than is a small biotech company with limited funding for obvious reasons. So we, as that relates to commission, we're thinking that potentially, we haven't implemented this, but giving higher commission on the public companies versus the private ones. And it's a function of the churn. So we're going to take a look at that. So I would encourage you to think of how you pay out and also who you target based on the likelihood of churn, which you can only do going backwards, but you could use your best judgment, which is a large publicly traded big pharma like Eli Lilly or Janssen or Johnson & Johnson, whatever, is probably going to have a less potential churn. So that's a component one. The seasonality component. So we've been looking at 10Ks and annual reports of our publicly traded competitors, or not even competitors, but large organizations that operate in our space. And what we've seen is that Q3, especially Q4, is when all of the pharma budgets are used and deployed. And so to that end, what we're hoping to do is set up on an annual basis our outbound prospectors, in-house sales reps, to hire them in May, June, July, right as they're graduating from university, which we've had the most success with those folks who've studied biology, biochemistry undergrad. So hire them, have them do 2-3 months of training, and the maximum the prospecting season at Sanguine is September and October. Historically, it's when we've seen the highest number of opportunities being created. November, December is highest number close. So we're getting our recruiting, training, and onboarding, and essentially deployment aligned with the sales cycle or seasonality of the business. But that's the way we're looking at that, so that you don't miss the whole year. Right, so you don't want to hire all those, for example, these kids out of school in November, December, and then miss that whole period, that whole year of growth.
Mm-hmm. Yeah, and I think that's just really been one of the themes that's gone throughout this whole hour, is just maniacally knowing your customer, and get any data that you can get a hold of, including K1s on your customer, leverage that. We're really almost out of time here. I'm just going to throw out one question for each of you. If there's one thing you could tell your former self when you were just launching Sanguine and Doctor.com about sales that you wish you knew then, what would it be?
I'll go first, Reed. Segmentation is critical. Play to your strengths. So we had closers prospecting and prospectors closing, and we didn't do any segmentation there. And we didn't do any segmentation on sales engineering, like product specialists. So segment, if you want to grow, you're going to have to segment. Segmentation is expensive, fine. Then what you'll have to do is make up for it with more prospects and higher likelihood, higher win rate, lower discounting, and other metrics like that. So yes, growth is expensive after a few $1 million. Just stay calm and keep segmenting.
Love it.
Bigger sales are better. It took us a long time to work into bigger and bigger rooms, and that in many ways, like at the end of the day, some person is going to decide. And so if you're going to have to convince one person, would you rather convince them for like $4,000 or like $4 million? And so to the extent it's ever possible to go bigger than the sale you're trying to close, go bigger. We had some of our most exciting moments like that when we would bring people in who are new to the business, who'd be like, oh yeah, I could sell this for XYZ. And me and Andre would be like, really? You think so? Like, that's not what the market has said so far. They're like, no, you watch. And they would go out and they'd do it. And that in many ways, like, don't limit yourself to what you've seen before. Like it's only impossible until you're doing it. And so going for those bigger ticket sales and really pushing for that expansion, I wish we had done earlier. We probably got shaved like 2 years off the 10-year journey, at least.
Yeah, it's so true. I mean, it can take exactly the same amount of time and energy to close $50,000 as $5 million.
Yeah.
That is just so true.
It's actually often more grueling to close the small ones. It's like real Pareto principle stuff.
Totally. Yes. The smallest percentage of your clients will give you the biggest grief. Well, thank you. This was so enjoyable. I think super helpful to these fellow health transformers. You guys are inspiring. Proud of what you do. Thank you for joining us.